Thank you so much. Being elected the president of the Union for International Cancer Control, UICC, last year is indeed a great honor, and I remain grateful to all the people that supported organizations, including OncoDaily, that supported my candidacy. As the president of the world's largest umbrella body for cancer organizations, which spans over 100 and almost 180 countries, consisting of over 1,000 member organizations in various capacities. That is indeed a huge responsibility. The organization is not just any one, it's the first that was ever established and has been in existence for over 90 years. UICC focuses its work on education, awareness, capacity building, and convening tangible events that lead to progress in overall cancer control. Embedded in all these pillars are issues that has to do with equity, that has to do with access, that has to do with putting patients at the center of cancer care. These are the principles that I, as a president, the first to be elected from the continent of Africa, is going to imbibe in my presidency. Like I said, it is a very organized, it's an organization that has its principles and work clearly laid out. And my role is to support that and to ensure that we imbibe the principles such as equity, such as making sure that we include everybody and have a really diverse organization. When I say diversity, I'm not talking about, oh, you're black, you're white. No, I'm talking about children. I'm talking about persons that are living in areas of humanitarian crisis. I'm talking about where we have a lot of security challenges across the world. Those that are not financially able to care for themselves. These are the kind of marginalized populations that I will focus on. Childhood cancer is indeed a great problem for African and other low middle income countries. And as a pediatrician, I would like to see more attention in line with global initiatives from the WHO, like the Childhood Cancer Global Initiative, being more accessible to those people from low middle income countries. We're also living in a time of great technological advancements. We have seen artificial intelligence really leap through and skyrocket in the last couple of years. However, a great inequity still exists in the balance of access and how it can help us to improve cancer care. Finally, I would also like to put the patient at the center of all our conversations. Like I said, UICC is already doing these things, but as an advocate and somebody who has worked very closely with the community in the rural areas of Africa, I believe that I have that experience and ability to reach out with those persons that are living with cancer in those type of areas and bring them to the table, bring their chair to the table so that we can have more meaningful conversations. Patient engagement has to move from being symbolic to really very practical. Cancer care is certainly expensive through the entire spectrum, whether we're looking at awareness, screening, diagnosis, treatments, and palliative care. It is an expensive disease to have, one that many people cannot afford. We must therefore focus on how we can work with governments, policymakers, multinational organizations, philanthropic organizations, and design innovative insurance models so that we can care better for our patients. The financial toxicity that comes with the diagnosis of cancer is immense, and even the well-to-do high-income earners from the high-income countries are not spared. So I am a strong believer in universal health coverage, in extending insurance models to cancer and oncology care, and to make sure that we educate people about the importance of buying insurance schemes. Many countries do not have national insurance schemes that cover cancer care, and we must continue to advocate very strongly for this. And this is one thing that I will be doing. Awareness is a low hanging fruit, but like I said, nothing comes without a cost. A financial tag is attached to that. And for us in LMICs, those countries of the world that we can really do a lot. If we increase awareness, we will directly impact early detection and directly impacts the prognosis, so that cancer can be seen increasingly as a disease that can be cured, that can be beaten, and not a death sentence.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.